We're talking about taking tolls. You have the politicians now competing with each other to see who can be faster to reduce tolls on the highways. We're hearing about buying back the 407, which would cost $30 billion or more without adding any new capacity to the provincial highway system. So to us, these are all examples of poor spending choices, understandable when there's an affordability crisis, but ultimately you've got to get at the root causes that make life unaffordable for people.
Don Drummond, can I get you to weigh in on the issue of the money we're spending and whether it is being wisely invested as opposed to just fueling consumer choices?
Just first, I heartily disagree with the notion that keeping the debt ratio under 40% is safe. We're spending almost 10 cents of the revenue dollar in interest on public debt. So that's money that's not available for health or education or supporting the social needs of the people of Ontario. The debt ratio should be much lower than that. I think 20% would be the highest that you would want to see on that front. Well, we could add a lot of lists to that. We've got these reductions in the gasoline excise tax. That's not a good use of the public money. That's a perfectly reasonable way to pay for the services that the people of Ontario want and need. We've spent this fortune just to get alcohol in corner stores a little bit earlier. I mean, maybe that's a desirable thing to do, but what was the need to rush with that and to waste the money on that? So I don't think the money's been wisely spent. I agree that if we have this economic damage, which seems to be coming our way, all we can do is we told you not to do this and you did it. You left us vulnerable, but that's not the time to do it. But on the other hand, the shovels are still out, making the hole digger. And there are needs that we have and ways that the money could be better spent. And we're just seeing it being wasted as far as I'm concerned.
Can I add a few pieces of waste to that list? I think about private equity in healthcare and how we need to be spending on healthcare. We've been spending a little bit more on healthcare than we have in the past, but we've also seen a lot of that money go to private delivery. So we still have a single payer system. It's free to me. Sometimes there's a little bit of an extra charge. But private equity is siphoning massive profits. And the more we allow private equity into that system, the less service we get for the money that we are paying. And so we could put some rules in place to limit that. And I think that would go a long way, not necessarily to a decreased spending, but at least to improve the quality of that service. In public transit, when you look at the infrastructure that's being built, think about the Eglinton Crosstown if you're in Toronto and how far over the time limit that is and over budget. Perhaps if we were worried less about making sure that private sector was making as big of a profit as possible, and instead we're focused on building the transit that we need with a reasonable contract and one that holds private sector accountable